Welcome to Season 3 of Under the Sisterhood, Women Making the World Healthier. We'll be featuring a podcast every Friday through the end of the year. Our conversations will focus on many different aspects of health and wellness. We'll examine women's health, general health, menopause, sexual health, and reproductive health, as well as we'll dive into wellness. This is a podcast to celebrate women and all that they do in our world. I'm Elizabeth Elfenbein. Let's get under the hood. Today, we're getting under the hood of Keren Leshem, a mother, daughter, sister, and the CEO and board member at OCON Healthcare, an innovative women's health company. She was recently featured in Forbes magazine as one of 3 women shaping the future of women's health and has been invited to the World Economic Forum as a technology pioneer and named one of 100 women of influence by Entrepreneur magazine. Keren is a board member at a Swiss company, ASPIVIX, and a steering committee member with the NIH, Bill and Melinda Gates Foundation, IEF, the Innovation Equity Forum, and she's joined UK's FemTech Labs Admissions and Advisory Board, as well as LSX's Advisory Board, and is a mentor at the Israeli 8400 Healthtech Network program. Prior to OCON, she served as a VP of Corporate Development at the European pharma company VISUfarma, and served as a board member of a BioLight company. As the founder and CEO of ViSci Ltd. And CEO of AOPharma, she has successfully led clinical R&D and BD activities to achieve commercial status. Keren believes in strengthening women and makes sure to lead with passion, integrity, and focus on her brilliant team of mostly women, service providers, and customers. And she loves what she does. Welcome, Keren.
Thank you, Elizabeth. It's wonderful to be here.
Oh, I'm so excited. This is season 3 is an amazing lineup of women, really women who are making the world healthier. And so I couldn't be more delighted to be featuring you and all that you're doing in life and at OCON. So if it's okay, why don't we get going?
Let's do that.
So, our focus this season is around health and wellness. I'd love to hear your story of your journey to health, into healthcare and wellness, and why.
So, when we deal with women's health, we get so passionate about it. Not necessarily because we suffer from any condition, but we can also relate to what's going on with our reproductive health, with our aging, with us being mothers. Anything that's going on is really almost hits home. Because if it's not us, it's our sisters, our mothers, our best friends, our daughters. And so it's really something that I'm very passionate about, but I can't say that I set out to be in women's health space at all. I stumbled across it by accident, and which is interesting because I've always been in healthcare. I studied some years of medicine, and then I moved into the healthcare industry. I did a lot of work in business development and corporate development and fundraising. And I even led some companies, but these were more in sleep apnea and ophthalmology, somewhat cardiology, stem cells. But when I stumbled across OCON, that was 3.5 years ago and 20 kilos ago. And I joined as a vice president sales because one of the products wasn't doing as well as the management thought. And very quickly, I realized that the board wanted to shut down the company. And they asked me what I thought. I knew the board, I knew the investors well. And I said, let me check. And, I use the product myself. So I'm a customer of my own company. And I thought, gosh, this is amazing. Look at the quality of life that this can provide to women everywhere. And then I became on a mission to take this technology and really look at pathologies and other problems that we have. And my gosh, this market has been so underserved and underfunded. And I thought to myself, if I don't do this, who will? And I want these products to reach the hands of every woman, in the world. So now it almost became a mission for me. I was offered the CEO position. I thought, could be nice. 3 years, a full pivot. It was very, very difficult. But I think that I'm in the right place to also try and educate and facilitate and bring forward a lot of women's health innovation, not just for OCON, but for anyone that I stumble across. I really feel passionate about helping and understanding the products and understanding our physiology and our anatomy, because, we're all going to go through it at some point, all of us women.
Yeah, no, that's amazing. Wow, a lot to absorb here. I kind of want to go back a little. You mentioned that in early stages you went to school. You had a science background. It would be helpful to understand. I think we also in previous discussions, have you been doing this all in Israel? Like, where did this journey begin into science and then into healthcare and now into women's health? And
Well, thanks for the question. I grew up in the United States. And I think that's where the first time I went into the dermatologist's office, I thought, oh, this is what I want to do. This is so great. The leather seats and the white coats. But then I moved back to Israel to join the military at the age of 18. And the healthcare ecosystem here is very different, for good and for bad, because everything here is public medicine. And in public medicine, there's not a whole lot of private medicine. And so I looked into the hospitals and I said, I don't think this is what I want to do. I'm a people's person. And I was then, offered a job in a Japanese company here in Israel, a liaison representative. And I thought, this is what I want to do. I want to do business. I did study and I have somewhat of a background in sciences, but I ended up doing my BA and MBA in business. But then, the kind of the bug of healthcare came back after about 10 years in the high-tech industry. And so most of my career I did in Israel with global companies. But I think the last job that I did before OCON was in Europe as well. So I really got firsthand knowledge on how things work in Europe as well.
So thank you for that. That's really great to understand. I'm kind of curious. So while you grew up in America, you were able to see, up until about the age of 18, you probably didn't have a good sense of understanding the system because a kid wouldn't know that. And I mean that respectfully, but you go back to Israel, and then your comment about public health versus private health. And then in Europe, what are the things that you're seeing or have seen in terms of being both a consumer, here you are a consumer, a woman who might need healthcare within the public system, as well as from a business perspective and a leader in the industry? What have you been seeing?
Well, it's kind of funny to say about the healthcare system in the US, no one can master it, even if you grow and live there, I think. It's very, very complicated. However, because it's more private driven and reimbursement, private driven, there's a lot of money to be made there. And so most companies internationally look at the US to be their first market. If we take an example of one of the products that we have in Europe, they would be out of pocket payment for $100, but in the US, they're reimbursed for $1,000. And so, the return on investment for getting products to the US is much higher. And so we're still learning the bits and the bytes and the pathway to the United States. What's Medicare? What's Medicaid? How does everything work? How do you get through FDA? How do you get codes? What does market access look like? We're still learning. And because we have so many different products, and these are all therapeutics, some have previous codes, some don't. And so we're really learning. This is really a journey that I'm looking forward, to accomplishing, but we are still learning all the time. But you see the big differences, from the United States through the rest of the world. And sometimes, and I talked about this today, the chairwoman of our board, she was sick. She had cancer. Thank goodness she's out of it, but she had to pay $1.5 million because she was in the hospital for 6 weeks. And I thought to myself, she has insurance, but what if you don't have $1.5 million? You die. Yeah, you die in the United States. And that is horrible to even understand. And, this is the type of cancer in women that is very, very underdetected. You only detect it when it's like at stage 4. So the options to really, come out of it strong is very rare. And so that, is very unfortunate. And so the pros and the cons, on one hand, for companies like OCON to come to the United States, there's a lot of, benefits in terms of, the financial models. But on the other hand, when you look at women and access to therapies, it's still, very upsetting and alarming everywhere in the world. If we look at the other side of things in low to mid income countries, these women are so remote from hospitals, there's not a lot of money there. And so we're building, pipeline products that can be done in the community. We don't want hospitals. We don't want continuous hormonal pills. And so we want to set it and forget it in the uterus. We want to make sure that these are safe, accessible products that can really help with our menstrual hygiene, fibroids, endometriosis, menopause, you name it. And so I think we all understand that the world is becoming a smaller globe, and we have to take care of each other.
Oh, I like that. It's like sisterhood for women's health, I mean,
Exactly.
no, I'm serious. And I think that this is such an interesting topic because what you just said in terms of, the safety around all women's hygiene, and all the different parts within women, I think is so interesting that your product can help provide that. And look at that. The products that OCON offers is really amazing. I think women's health, and I just attended an amazing event in New York City last week. Her MD, it's a new, it's a women's it's more GYN that services just this. And that would be a company I should connect you with, actually, the founders. But she founded it because the women weren't getting the care they needed, and then they weren't allowed to provide it. So they're looking at a different model of care in their, I don't want to call them clinics, in their offices. Anyway, they have 3 or 4 offices, but they put on this event and they had women come and speak about everything from menopause, sexual health, reproductive health. It was a very interesting conversation and great session. I was like floored by it, but it really prepared me to have the conversation with you today, because I don't think that women think a lot about their health until something goes wrong, until something happens. When something happens, we respond to what's happened versus really looking at prevention. And I think, what are your thoughts on that?
So, wow, this is a huge issue with education and access to knowledge. You and I, if we look at each other, we live in countries that are modern, we have internet, we have basic language skills that allow us to go and search for information. And yet, we're so, excuse my French, dumb when it comes to our own bodies. So, I'm 47 almost, and I'm going through perimenopause. Nobody talks about perimenopause. That's the, a time frame before menopause, before we stop bleeding. And you're going crazy. One of my team members said, I think I need an ophthalmologist. I'm going blind. My eyes, I can't see. They're blurry. I'm tired. I said, you know what? This is perimenopause. We have dry eye. And, the sleepless nights, the sweat at nights, anything to do with changes in mood. But nobody talks about it. And, our mothers didn't talk to us about it. And I hope to change that. But I really also think that when you look at different initiatives for women, and I'm part of the World Economic Forum, the Bill and Melinda Gates NIH steering committee, most of women initiatives talks about mommies and babies. We're women a lot before we're mothers, and we're women a lot after, we're mothers. And we do a lot of clinical studies in women's health. We're now focusing on menstrual hygiene and abnormal bleeding. Do you know how hard it is to get women to join our studies? Because we're busy, because we can't, focus on taking care of us. It's just bleeding, just anemia, just the fact that I need a blood transfusion once in a few months. It's crazy because we minimize and normalize some of our symptoms because we're busy, overworked, need to make sure that we, function well. And so it's very upsetting to see, but I'm very, very optimistic because we're talking about it, and we're talking about it more. And I think the younger generation is a lot more educated than we ever were. I know how I am with my daughter around period care and around our bodies and body image. And so I think really that education is key. I make a point of really volunteering and making time to create policies at the forum, the World Economic Forum, and in other forums to make sure we really bring forward products that can help us with our, symptoms and with our lifestyle and with our quality of life, but also around education. I had an investor once ask me, you do so much more than just, manage this company. Do you have time for everything? And I said, I don't have a choice. This is not cardiology or brain health or cancer that everybody just knows that it exists and it's important. People here need education, and we need to be out there and to talk about it. And so, this is the purpose of this conversation that we're having today, with many other conversations that I have, to get the word out there. We don't have to know everything, but at least we need to know that there is knowledge out there that we can tap into. So that's super, super important. And I'm really happy about Her MD. I think that's an amazing initiative. I think it needs to start in medical school. Doctors and general practitioners need to focus a little bit more on menopause and on women, and to talk a little bit more about diseases and conditions and, pathologies that we suffer from, all the way from how we have a heart attack, which is very different than a man, through, some of the symptoms that we suffer through with perimenopause, to know we're not going crazy, to really know we're not going crazy.
So wow, yes, and wow, such you've unpacked it, but it's interesting having been at that event last week where the discussion around, I want to first address your perimenopause, huge discussion around that. From a company. So there was a panel that had women who were going through perimenopause, and it was a menopause panel. It was very interesting, the conversation around like where you are, what you can take in terms of hormonal therapies, what's off label, what's on label. And interesting, the founder, there's 3 founders of Her MD. One of them is an OB-GYN, a gynecologist, and she spoke about some of the things around that. Then they covered the perimenopausal content and really educating around that. The other thing they talked about was menopause, and the fact in med school, and the fact that women are required literally to take, I think, 2 hours. I think that it might be 2 hours. Don't quote me on that. So what happens is a number of women, and they just brought in this wonderful woman, that wonderful physician who will be opening the Atlanta office. And the reason why I'm bringing that up, I'm going to be interviewing her. And she went out and she paid to have a menopause certificate, to get a course in menopause, because women physicians are not educated around menopause. Well, how do you help literally guide your patients through this journey, which is, it's like postpartum. Unless you've experienced it, you don't know what it's going to be like.
But the only difference is to postpartum is that we will all go through it. 100% of women. 100%.
So and couldn't agree more. I mean, it's not debatable. So we go through this journey of perimenopause and then menopause, and we're living it. And yet it's a stigma to talk about it, to have a conversation about it. And I do think you're right. Conversations are starting to come up and bubbling up. But like it's interesting having conversations with young women for instance, in Pakistan. I'm currently having a conversation with a young woman, and we're talking about period health, and education around, women's hygiene and stuff. And I think that they're having conversations that we don't even necessarily have here if you're not having it at home. And I just think about, I have 2 daughters, they're grown, and I'm an empty nester. And I think about the conversations that I didn't have enough of.
Exactly.
Because I didn't know how to have the conversation, not because I'm not an open mother, an open person. I didn't know how to have a conversation. And in hindsight, it's interesting because so I have 2 daughters and a son, and my middle daughter, Georgia, is talking about like, there's so much shame attached to having a period and how you feel about it. And she says, I want to destigmatize this, Mom. And so she's on this kind of journey, but yeah.
That recently Spain, the country of Spain, announced that they will pay companies for days loss of work for women that suffer from period issues, right? So
Mm.
everybody was like, wow, Spain is amazing. This is amazing. No, 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 no. This increases the gender gap. Me as an employer, if I know that every month I'm going to lose a certain employee for 3 to 4 days, even if I'm paid for it, I don't want it. I want a guy that doesn't suffer from it, right? That can work, the 22 days out of the month that is necessary. And also, I'm thinking, you're not solving the problem. These women suffer, obviously, because they need a few days off every month. Solve the problem. You're just transferring it to home, right? So they still suffer,
Addressing
but they're
the
doing it at
symptoms,
home
it's
instead of
addressing
doing
the
it at
symptoms.
work.
Yeah.
Take all that money and put it into education, put it into companies that are doing research to solve these quality of life issues and shame issues. And that's such a better use of funds than just paying off and increasing this gender gap. So it's, the intention was very, very good, but I think the outcome is not very good for women. And there is shame around it. I fundraise since the moment my foot stepped in the door at OCON. It's so hard to get funding for women's health, not because it's hard to get funding, but because the check sizes are so small. And so you need a lot of little checks, right, to get, because we're doing, we're therapeutics, we're a drug. We need to do big studies. And so I see the fact that people sometimes cringe in their seats, and I try to make, period health and women's health and uterus health a business, right? Not to make people feel uncomfortable, usually men, but sometimes even women. When you talk about these disorders or conditions or pathologies, they look, and mostly men, and they think, I don't know anything about this. Is this a big problem? Is this a small problem? Can you give us more data on the market? And you're thinking, 51% of the world is women. We all have a uterus. This will be, an issue for us at some point. So yeah, it's very, very challenging.
And it's so interesting just to hear your perspectives, Keren, just both as a CEO of a company and that gender gap, the fact that it increases it, even though I'm sure you're hard as a woman, it's not solving the problem. It puts you in a very, and I think that I'm using you as an example. Having said that, it probably wouldn't have gone that way in the conversation. But imagine the other companies where it isn't a woman. The truth is, we're running a business. So losing your employees X amount of days a month,
Exactly.
period pain or anything related, endometriosis, any sort of women related thing, only highlights the fact that it puts women, it depositions women. And
Exactly.
and then,
Exactly. And why do we even need to talk about it with our employers? Right? It's not like you're going on vacation. This is an issue. This is a big issue. I agree. But I'm also an employer. Our team is 85% women. I do believe in gender diversity. I always laugh about it. So I have 3 men. But I do think, and I see that we need help sometimes. The hours that we can work aren't as long, but we do a hell of a job because, we're so committed and we're so smart and we're so loyal. And so I really make it a point to push women forward and make sure that, most of my management and most of my team are women, because I can.
that's wonderful. I mean, that's wonderful to hear, but I want to say something about that as well. We don't work as long hours. We work smarter. We work harder. So
I agree.
if we're working 7 or 8 hours in a day, because we have children, because we have all these different things we're trying to manage in our life, we always
Correct.
feel like we have to jump through hoops to prove ourselves, to be equal to a man, and we're never equal, even though we're performing at 150%. I have a story to tell you. After I had my 3rd child, I got hired by a company, wonderful company. I was there for 7 years, 5 months pregnant with my 3rd child, my son. After I had my son, my boss, so I'm a creative, so I had a creative director. I was right under him, and I worked on Citibank at the time, and it was a great assignment. And I just carried, this was like yes, I had a computer, but I always carried a book with me with all my lines, even though I'm an art director and designer by trade. And I would just write headline after headline just to prove my value. So I would go in, I arrive at the job, advertising is usually a 10 to 6 thing or 9 to, and then I would keep working. I would work on the train in, I'd work on the train home, I'd work after I got my kids to bed. And he said to me in my review, I wish you could put in a few more hours. You are so talented. I'm getting so much. And I'm thinking, dude, I've just delivered 3 times as much as the next person. I'm selling in 70% of the headlines, and I'm an art director to Citibank, and you want more hours from me? I said nothing. I just
Amazing.
literally, I mean, I'm like, I think I'm 35 or 36 years old, and I'm sitting there like, oh my God. And I'm like, and I just took it, and I'm like, okay. And literally it took 3 years to get a 1.5% raise. Like, I can't even, but I loved my job. I liked my team. It worked for me because I had 3 kids. So I absorbed stuff that wasn't fair.
Correct.
And I think
Correct.
that back to the comment, and it's a long-winded and a little bit of a tangent, but I think a good part of the story is just to highlight the fact that women have to work twice, 3 times as hard to be perceived at 80% of the value of a man. 3
I
times
totally agree.
at
I
80%.
totally agree. We're now toying with the notion of going into a 4-day work week. And the biggest reason for me to push that is quality of life. We work so hard. We work on weekends, we work at night. And most of OCON are women, and I know they're so dedicated. There's not one person on my team that doesn't, work, I don't know, sometimes 14 and 18-hour days. And so to allow us to have another day off where we can run errands, we can just be with our family, lunchtime, when the kids get back from school, I think that would add a lot to the quality of life. So I'm really toying with that idea. I wonder, because we also have manufacturing, I wonder how that will affect manufacturing. But I've read a lot of, background on companies that did go to a 4-day work week. And it's incredible to see how much more passion and loyalty the team members had, because they could only have 4 days, so they did even more work and a lot more focused.
I was just going to say, I think retention will be fantastic, which you don't have an issue with because you're already creating a good environment. And I think that what I will say, just from my observation, have been being in the workforce, people will do what they need to do to get their work done. So
I agree.
offering that 4-day work week gives them the sense of freedom, even though they'll probably work those 3 other days because they're already working. They still have to get the work done. So I think that
Exactly. It really showed that that people took a lot less, sick days, a lot less personal days, just worked really hard in those 4 days. So I'm really contemplating it. This may happen, very soon. Also for my team, we work so hard. This has been a very hard 3 years for all of us. A lot of stress, a lot of, challenges to get these products to market. So I'm considering it, but it's really about a quality of life, and because we're mostly women. And I know that we will, take advantage, true advantage to rest and, be with the family on a Sunday, because in Israel here we work on Sundays and then work the rest of the week, Monday, Tuesday, Wednesday, Thursday. So let's see.
Oh, I look forward to hearing that. I think that would be a great thing for your company. I think it only just engenders a mindset. It really talks about the culture, because women are going to be dedicated, loyal anyway, because the cause and the mission is so good. So I'm curious, Keren, I mean, this is a fantastic conversation. I'm curious. So talk a little bit about the product. So you talked a little bit, you mentioned, education around all the female issues from menopause and stuff. When you look at your products at OCON, what areas do you serve women?
So we're very focused on uterine pathologies, anywhere from bleeding or heavy or abnormal bleeding can be caused by 2 reasons. One could be a structural reason, something physically is in there, like a cyst or a fibroid. So that's one cause. And for that, we now only have a choice of hormones. And the other cause is non-structural. There's nothing in there. We just, have an abnormal way of developing the lining of our uterus, the endometrium, that kind of bleeds out every month. And this could be very debilitating. And so that's the first, kind of indication we're working on. We want to have non-hormonal, ways to treat women in the office or at home, where, we're not subjected to take all these drugs through our mouths that cause all these side effects because they are absorbed systemically. And on the other hand, the other options we have is to take our uterus out or to have a very debilitating procedure in the hospital. Why? Nobody paid attention to that. And doctors are so, easily removing our uterus. It's there for a reason. We need it, for the sake of holding in place other organs in the body. Not to mention, that if it's taken out before we go through menopause, we do age a lot quicker, and it's unnecessary. It's a very, very painful procedure. And so we really want to move away from systemic absorption of drugs and debilitating hospital, invasive procedures with these little stents that deliver drugs to the uterus. And so we call it, set it and forget it. And so there's no compliance issues. The doctor is always there to make sure it's, inserted correctly. And then you go on your business and you can take care of your bleeding. The other indication we're looking at is uterine fibroids. 7 out of 10 women will have a fibroid in their lives by the age of 50. 7 out of 10, 70% of women, 80% women of color. This is such a prevalent condition. It causes bleeding, it causes pain, it causes us to be infertile. And so, we have to take care of it. That's the other condition. And the third one that we're really focusing on is endometriosis. Endometriosis is when the lining of the uterus kind of moves out of the uterus into the other parts of the body, and it's like lesions. And these lesions flare up every month during our period. They act as the lining, but just outside the uterus. It's so painful, and it's so hard to diagnose. It takes today an average of 5 to 6 years to even diagnose. And during those 5 to 6 years, when women literally are in debilitating pain, they're called, drama queens, and, come on, it's all in your head. We're even given, sedatives and other drugs because, we're called crazy, which is crazy, right? When a woman says she's in pain, she must be in pain. And so that's not taken very seriously either.
So I'm sorry to interject. I apologize for that, but I do want to say something about that. What's crazy to me is, with all these diseases that take you 5 to 7 years on this journey to diagnosis, it feels like there needs to be these public service announcement campaigns in whatever capacity, social, whatever it is, where it says, hey, if you are feeling these things, ask your doctor if it might be endometriosis. Because for any woman to suffer, I've never had like horrible period pain. Knock on wood. I feel so grateful for that.
Me neither. Knock on wood.
And I'm grateful. My one daughter had some period pain, not bad anymore, but I'm so grateful that they didn't have to experience it. That said, when I hear about women who suffer from this, I can only imagine, because I've had children and understand that type of pain.
Exactly. Exactly.
So the fact that isn't universally understood is so insane to me.
But again, I'm very optimistic because this is now being discussed. I've had numerous friends and, colleagues from the industry call me up and say, you know what? I think my daughter has endometriosis. I've heard you talk about it for like 2 sentences. Could you refer me to like a good doctor that could take a look? And you know what? There's this one, physician here in Israel that I refer every patient that thinks she may have endometriosis. And even though he sends them to an ultrasound specialist that he trusts, even the ultrasound specialist doesn't always manage to detect these lesions. And the only way to detect these lesions is to physically go in laparoscopically, right, into the body to look for these lesions. And you know what? He made decisions on numerous occasions to go in, even though it creates a little bit of a hole in your belly, but he found them. And so it's so alarming. Like, I feel I'm so lucky to know these doctors that can help with these conditions, but what about the other gazillion women out there that don't have access to that, or doctors that really want to take this, forward and check and test? And so I'm optimistic because there's so many companies now working on diagnostics. There's a lot of discussions around, these conditions. And so at least women are hearing about it and are acting up on it.
I mean, it's interesting, and I just think from the US perspective, I don't really know this because I have worked in healthcare and wellness from an advertising perspective for 25 years. And of course, I know endometriosis. I have never worked on a product for that. But what I want to say about it is that I wonder if even like the young women slash the mothers slash the women who have endometriosis even know that in order to detect it, it is more than just a sonogram. You should look into laparoscopy, like
Yeah.
that to truly be detected, like to know that. And I think there's things like this. It's a simple thing. There's 3 steps. Like if you're feeling this pain, go to your doctor, ask about endometriosis, get the sonogram. If the sonogram comes back negative, you might want to look, if you're still suffering from the pain, you might want to look into laparoscopy, because that's the only way to diagnose it. But women don't even know that. And so, and so
Correct.
back to your earlier comment, Keren, which is what in Israel is that you could be losing women 3 to 4 days a month due to endometriosis pain or period pain or something like that. If we educated them around this whole female hygiene and female, the orientation of the things we go through from a women's health perspective, the system would save so much money because they'd know to ask the right questions to get the right treatment and what have you, because
Exactly,
nobody,
for sure.
and I will tell you one thing, I can't imagine that anyone's going to sit for an extra day in pain if they don't have to, meaning they'll go, when you have a condition and you don't know it exists with you don't feel it, you're not likely going to go to your doctor to do any sort of prevention. However, if you're feeling pain, you're going to do everything you can to get treatment to deal with it.
Correct. But the problem is that we normalize it. When I asked my mother, did you suffer from heavy periods? And she's like, that's just the way it is, right? It's just the way it is. And when you look at these girls and women that suffer, I had a friend that was identified with endometriosis at the age of 48. Before that, she wasn't suffering any pain, but it began all of a sudden very, very late. And she was offered, pills for like crazy people. And she was just, going mad. And she said, I'm not making this up. I'm not a drama queen. I am in so much pain. I'm on the floor. I can't even get up. And so it's very, very upsetting that, you do live in pain because we normalize it, because doctors don't believe us when we say we're in pain. And we're offered all kinds of treatments because the diagnostic tools are not there. And so there's still a way to go. But again, I'm very optimistic because now at least, women can stand on their feet and say, I know there's a disease like this, and I need you to check harder or deeper or better.
Oh, I love that. The other thing, just hearing you say that, Keren, is I wonder from a university, when you go into med school, is looking at the programming in med school is offering women's health. I'd be really curious to understand what that portion of their curriculum is for med school, because I think that understanding that, and even from a gynecology perspective, so you would have the med school, then you would go into your residency where you're specializing. So you'd be going into gynecology. If your system or your space isn't seeing that type of patient, the question is, how much education is there around women's health?
But you know what? It's so much broader than that, because we're not only uteruses. And I always say we're not mini men. We're not small men. The way we react to drugs is different. The way we suffer from heart attacks is different. Women suffer a lot more from headaches that can lead to all kinds of other debilitating conditions. It's a whole, women's health, perspective that is so different than men's health. And, it's not a secret. Most the studies were on men that are usually white. It costs so much money to get drugs approved. And so we want to make sure that they are consistently taken by people that don't have a hormonal cycle that may skew some of these results. And so it's very hard to get, women's health on the radar and to really prescribe medicine that fit our anatomy, physiology, and our, and the way we tolerate medicines. And so there's still a ways to go. But I'm very, again, optimistic because I think discussions around it are happening. And so, yeah.
Oh, I absolutely love your optimism. This conversation's been really interesting. I'm curious, as it relates to women's health, what would your big overarching message be as, the CEO of OCON Healthcare? What is your message out there? And then I'll ask you in a little bit what your message is as Keren. But I'd love to know what you think.
Well, I think in general, I'm a very grateful person, and I think we need to show gratitude um, and give back to the community. It's not enough to do good with products that we want to bring forward, because at the end of the day, this is a business, and I have shareholders, and we need to maximize, profits and the company valuation. But I think that at the end of the day, we're in positions where we can do good. So pick one cause, that does good to you, to your environment, to your company, to your fellow humans. We adopted a college of women that escaped the prostitution cycle because we can offer them jobs. They have, big gaps in their CVs, and nobody wants to hire them. They don't have any qualifications, but we can, and we can then give them a reference. They can come work for months, or even we had a woman, a gorgeous woman that was trafficked from Nigeria that worked with us for over a year. It's really incredible to see, the team and the person itself heal from working and doing something that, has a cause. And so, I always yell out to all the other, executives, do one thing that you believe that will do good, not just because your company may be doing good, because you can do better for society. We also have a guy that is on the spectrum of autism. We had to let him go last month, but he worked with us for a year. And again, if he doesn't work with us, where is he going to work? And so just do one thing that, does good. We're not flourishing with funding, but I think these are things that are more important than any, bottom line of any company. So that's my message.
I absolutely love that. And I can so relate to it. We've developed wellness programming that we've gone into. We're going into organizations and universities. And interestingly, just the first part of that is the self-discovery. And I think that you giving jobs to people who, I don't want to say are marginalized, that might not be the perfect word, but might not have the opportunities. You're doing so
Right.
much for their self-esteem and building things
For
in
sure.
them that is setting the course, the trajectory of their future up. So it's doing good in just the biggest way and making meaning. That's just really beautiful. So that's your message to the world as the CEO of OCON. Keren, we're speaking to women around the world of all ages, of all backgrounds, LGBTQ, trans, and of all cultures. What would you want them to know from Keren Leshem?
Wow, that's a good question. Just be inquisitive and ask questions. Don't take it as a standard, issue when someone says to you, I wish you could work more hours, or someone else says to you, you don't work as hard, or you're not as successful as the next person. We have to be where, where we feel good. And so sometimes we don't feel that we have a choice, but we do. And so we should build, communities that we're happy to be part of, and have people around us that make us feel good about ourselves and about our, everything from our bodies to our brains to our work. And it could be anything. It doesn't have to mean that you need to be some CEO or some executive. You can choose whatever you want, but you need to put people or have people around you that make you feel good and appreciate it and appreciate back, right? Appreciate the people around you and make sure they like being around you. And so that's my biggest kind of message that I can relate. And I feel so lucky to be heading this incredible company. And we built a team, a family that is such hardworking and so wonderful and great. And everyone is their own person with so many different, points of views. And so I feel very, very lucky. And I have the power to do that, right? To build a community around me, around what I work with people that I like and that, do well and that, push me and I push them on a daily basis. So if we can do that collectively, I think this would be great for our well-being.
Oh, wow. That's beautiful. That is really beautiful. And I couldn't agree more. I think that what you hit on was, and it's building sisterhood. And whether you're doing that in the community, in your literal community, like your hometown, the community you live in, the community you work in, the community you go to school in, the community friends, surround yourself with people and women who are going to lift each other up. And I think that that's one of the things, you know, I just love this. I think this is so great. My heart is like really full right now. My cup is full because you are saying the message that we as women need to collectively get behind. When you do those things that you're suggesting, when you create that environment as a leader, and you can be a leader at a mid-level, at a junior level, leaders come in at all different stages of life.
Correct.
These are
Absolutely.
people who demonstrate and want to help affect change in a positive way. So when you create those environments, women are inspired. When you create those communities, women are inspired. They feel loved, they feel supported, they feel safe. When we do that, they show up and they deliver because women have so much capacity. And so, wow.
Exactly.
I'm just, I love this conversation. I don't want it to end. This has been awesome. Thank you so much. You are doing a wonderful job making the world healthier. So thank you on behalf.
Thank you, Elizabeth, for giving me a spotlight here to talk about it. This was a great conversation. You are wonderful.
Oh, thank you. Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, and Twitter so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood, LLC, and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Zach Slaff, and edited by Zach Slaff. The music is by Ayla Schaefer, her song, Rose.